Hello, my name is Dr. Greg Simcoe, and the question is, can you help someone with Meniere's disease without the use of drugs or surgery? Well, I'm here to tell you, yes, you can. Meniere's disease is a mystery to the medical profession, but it is in actuality an autoimmune disease. In other words, your body is attacking your inner ear or elements of your inner ear. That's the feeling you get where you feel like the hum in your ear or as though you have a full ear or you have water in your ear. That's actually your immune system attacking it. Um, what happens is that your immune system becomes imbalanced for whatever reason. There could be many different types, and there are a few culprits that I'll mention at the end of the video. Um, and what happens is your immune system becomes out of balance and it starts trying to eliminate those types of things that irritate your body. But then because they're in your system, it starts attacking you. There's a way of calming down your nervous system, your autoimmune system or your immune system, and that is by reducing the amount of inflammation it has. Now, what happens in Meniere's disease is that this attack occurs to your inner ear and starts destroying it a little bit and destroys an area where it actually relates to your balance. In other words, your perception of the world. And what happens then is that because of other parts of your balance system not working to its full capacity, you feel vertigo or dizzy. Your world's spinning, your head's spinning, you feel lightheaded or what have you. And these attacks can come and go, and that's a very typical type of scenario with these types of autoimmune diseases. Sometimes the body flares up, becomes very inflamed, you get an attack, and then you get dizzy. Now, there's two elements with treating Meniere's disease. One is to find out what is actually causing the autoimmune problem, and the other is to find out what other parts of your balance system are not working in order to compensate for the loss of the inner ear. Now, the balance system is made up of your ears, your eyes, your neck, your feet, believe it or not, and also a place in your brain called the cerebellum, particularly the middle of the cerebellum. That's all has to do with balance. Now, if your ears are alone affected, or your eyes are alone affected, or your cerebellum alone affected, those types of things can be compensated by the rest of your system. However, if, for instance, your ears are affected, as in Meniere's, and your cerebellum, which is in part of the brain, are affected, both, then you will have most likely vertigo experiences or dizziness experiences, lightheaded experiences. So the trick is to find out or to help the autoimmune part so it doesn't happen so much, and also to find out what part of the other balance system doesn't seem to be working correctly. Now, one of the things I can tell you, one of the biggest culprits in autoimmune disease in the United States is gluten. Now, gluten happens to be a protein found in wheat or barley or rye. Now, what I usually tell people is try and get off gluten for a while. Try and avoid wheat products, barley products, and rye products to see how that affects your Meniere's disease. I've had many patients in here notice a significant improvement in their balance issues and also in the number of attacks they get from Meniere's disease by simply eliminating gluten. And I'm here to tell you that's one of the best things you can do for yourself is to eliminate gluten. The other thing is to find a physician or a therapist that knows how to deal with those other parts of the balance system that may not be working. Find out what they are. Each one has its own unique presentation, and that physician or therapist needs to know what they are. So, the things you can do for yourself if you suffer from Meniere's disease without surgery and without steroids, and particularly those types of things don't seem to work very well for Meniere's disease, is to get off of gluten. Stop eating wheat products, barley products, rye products. Try that. Try it for at least 30 days and see what happens. And the other thing is find someone that can help you with the other piece of the problem. Thank you, and have a great day.